I'm Dr. Matt Bartels, Chief Medical Officer for Blue Cross Blue Shield of South Carolina. Today I wanted to address some questions about coronavirus, also known as COVID-19. For more detailed information, I would encourage all of you to visit the Center for Disease Control website. First, clean your hands often. Wash them with soap and water for at least 20 seconds, especially after you've been in public places or after blowing your nose, coughing, or sneezing. If soap and water are not readily available, use a hand sanitizer that contains at least 60% alcohol. Cover all surfaces of your hands and rub them together until they are dry. Avoid touching your eyes, nose, and mouth with unwashed hands. This cannot be emphasized enough. Avoid close contact, especially with people who are sick. Put distance between yourself and other people if COVID-19 is spreading in your community. This is especially important for people who are at higher risk of getting very sick. Also, be on the lookout for symptoms such as fever, cough, and shortness of breath. If you think you've been exposed to COVID-19 and you develop a fever and other symptoms such as cough or difficulty breathing, call your healthcare provider for medical advice. If you're a close contact of someone with COVID-19 or a resident in a community where there's ongoing spread of COVID-19 and you develop symptoms, call your healthcare provider and tell them about them and your exposure. They will decide whether you need to be tested. But keep in mind that there is no FDA-approved treatment for COVID-19, and people who are mildly ill may be able to isolate and care for themselves at home. Other options are available, including virtual visits using telehealth. One of those is Blue Care on Demand, which is available at no cost to our members using the coupon code COVID-19. Additionally, there are free telehealth services available in the state through the larger systems, and they are screening for COVID-19 at-risk patients. You can link to them through the Department of Health website. Due to demand, we encourage anyone who is suffering from COVID-19 symptoms to call their doctor to receive appropriate instructions. If you do not have a doctor, contact your nearest hospital system's website. Most of them are offering online triage. Because the situation is changing daily, we recommend this approach so that people are referred to the appropriate sites for testing. Patients have a swab. Think of it like a long Q-tip inserted through their nose to reach what is known as the nasopharyngeal region, from where cells are collected. Once the sample is taken, it's put into a sterile container and sent to a lab, where a chemical is used to pull the cells off the swab and turn the sample into a liquid form. That liquid is then put into machines that go through hot and cold cycles to make multiple copies of the virus's ribonucleic acid, also known as RNA, which carries genetic information. The machine looks to match the coronavirus RNA to determine a positive or negative result. Test results should be available within 48 hours. Your testing site will review how you will get the results of your test. The test for COVID-19 is free to our members, including those in a high-deductible health plan. There may be additional charges to include office visits or other tests to rule out diagnoses like the flu or similar respiratory conditions. There is currently no FDA-approved treatment for COVID-19. However, your doctor will recommend ways to manage your symptoms. Some people may be hospitalized, especially if they're having respiratory issues. For those that have manageable symptoms, we recommend staying at home. Here are some tips. If the patient is getting sicker, call his or her healthcare provider and tell them what the patient has laboratory confirmed COVID-19. Household members should stay in another room or be separated from the patient as much as possible. Household members should use a separate bedroom and bathroom, if available. Prohibit visitors who do not have an essential need to be in the home. For more tips, please visit the Center for Disease Control website. Blue Cross will waive prior authorizations for diagnostic tests and for covered services that are medically necessary and consistent with CDC guidance for members if diagnosed with COVID-19. The health plan will make dedicated clinical staff available to address inquiries related to medical services, ensuring timeliness of responses related to COVID-19. Blue Cross will cover medically necessary diagnostic tests that are consistent with the CDC guidance related to COVID-19 at no cost share to the member, where such testing is not covered as part of the public health service response. We will ensure patient testing and any subsequently needed care are done in close coordination with federal, state, and public health authorities. There are not limitations on the number of times a member can get the test. Members may be tested to exclude other diagnoses with similar symptoms to COVID-19, like the seasonal flu. The cost for these tests will apply based on the member's standard benefit. Blue Cross members who have mail-order pharmacy benefits are encouraged to consider using them. For members who have concerns about running out of medications, we recommend they first contact their doctor or pharmacist. Members can call the customer service number on the back of their ID cards for benefit-related questions. Blue Cross South Carolina is also aware members may have concerns about accessing their maintenance medications. With the pandemic, we have all seen a rush to purchase essential items, and this is understandable in times of uncertainty. But if the same stockpiling happens with medications, there could be local and national drug shortages, meaning people in the most need of certain medications may not be able to get them. We are thoughtfully and responsibly putting processes in place to ensure our members can obtain medication refills early if needed. If they have questions, they can call the number on the back of their ID card. The virus has put a lot of strain on the hospital systems. Because of this, elective surgeries will likely be postponed. To support our members in this time, we are working on extending our prior authorizations 6 months from the original surgery date. Unfortunately, in extraordinary circumstances, it provides opportunities for scammers. We should all be mindful of these bad actors, especially when giving out personal information. Blue Cross and our partners may reach out to members with updates on their benefits, with questions, or with program information. If you are confused, call the number on the back of your member ID and speak to a customer service advocate. During this unprecedented time, there's undoubtedly going to be significant stress. If you are concerned and think someone needs more support, there are options. Depending on the benefits available, employees may have access to an employee assistance program for screening of mental health issues and counseling, plus additional supports. There is also telehealth with behavioral health services, or they can always contact their primary care provider for guidance. Encourage employees to keep a schedule, to perform mindfulness activities, to take time for self-rejuvenation, to use FaceTime and technology to stay connected with others. Make sure your leaders are supported, to stay connected with remote workers, to proactively address the stress. Frequent communication is important even if you do not have all the answers.